KHTS.
It is 4:39, and I've got an in-studio guest. My name is Tori, and I want to welcome Dr. Megan LeCornu. Yay! Hi, Megan.
Hi, how are you?
I'm doing fantastically. I love the smile, and
Thank you.
that's what we're going to talk about because you are, is it orthodontist? Is that?
Yeah.
Because that's when I was a kid, we used to say, oh, I'm going to the orthodontist.
Yep.
So it's still, there's no specialty name.
Well, it is. So orthodontist is a specialty. So after you go to dental school, so dental school is about 4 years. And those people who want to specialize in moving teeth and fixing bite problems, they go to an additional 2 or 3 years of training after dental school to become orthodontists. So an orthodontist is a dental specialist. They, go on and they basically, it's just like, with your physician. You have your general physician, and then you have your cardiologist.
Your specialty.
Yeah.
Gotcha.
So same thing. So an orthodontist is a specialist. Yeah.
And that's what you are.
Yes.
You like to make the teeth straight.
I do. I love making people smile. It's an incredible profession that I have. I feel very blessed, very lucky. I go to work every day, and my job is to genuinely make people smile. So it's awesome.
Literally.
We
overuse that term. You can use that term.
Yes, and it's very literal.
I've seen people change their demeanor after they have, they're afraid to. I've known people who smile but would do closed mouth smile,
absolutely.
because they don't like the teeth.
Yep.
They have a crooked tooth or a brown chiclet. Something's going on, right?
Yep.
Once they get it fixed, it's like. They don't just smile; they smile with their eyes. They're like the whole thing changes.
Yeah, they're honestly, it's life changing. When you're able to smile and you're able to smile with every aspect of yourself, and you're not afraid of hiding something, it's life changing. I still get letters from patients, who finished years ago, and they send me a copy of their Christmas photo, and they just say, "I can't thank you enough."
Right?
And what's really awesome is I think the technology is changing so much in orthodontics that it's reducing those hurdles, those barriers that we used to have. So back in the day, everyone was afraid of being like the brace face, metal braces and that whole thing. Nobody wanted that.
I was tinsel teeth, by the way.
They're tinsel teeth. See, yeah. I like that. So, nowadays the technology's changed so we have a lot more aesthetic options available to us.
I was going to ask you, because I've seen people walking around with the clear trays.
Yep.
And I couldn't tell whether or not they're whitening their teeth or their braces.
Yep.
What's going on there?
Yeah, so they could be whitening or it could be actual type of clear braces called clear aligner therapy. Invisalign is a particular brand of clear aligners. And, the nice thing is things like Invisalign, the technology that they have brought to the table is completely changing the scope of orthodontics. We can treat almost every case that, you treat with braces, we can do with clear aligners now.
And how does it work?
And what it does is basically you switch out the aligner anywhere from 7 days to 2 weeks, depending on the situation. And you get a new aligner at every period, and your teeth move progressively between each aligner. So they keep switching out the aligners, and that's what causes the teeth to move. The thing with Invisalign is the doctor is doing all the work, setting up the treatment plan, doing the digital setup, deciding what changes are going to need to be done. And all that done is in advance to fabricating the first set of aligners. I always tell my patients that they're going to get their Invisalign in batches. So the first batch is the big movements, and then the next batch is kind of detailing things out. And then basically at the end of their treatment, they have a beautiful smile. And half the time or most of the time, people don't even realize went through treatment. Yeah.
So I had braces a million years ago.
Yeah.
And I had two different things that used to hurt, and it sounds like they were moving my teeth. The rubber bands.
Yep.
And the headgear.
Oh, yeah. You had it all.
I not only had headgear that went around my neck, I had it that went around my
Oh, you had the combination.
Yeah, I did. Yep. And I hated it so much that in the middle of the night, I would, in my sleep, unhook it, and it would end up on the floor in the middle of the night.
Oh, yeah.
I didn't even realize I did it.
Yep. So we do have different appliances now that, in our office, for example, we don't really do headgear in patients over a certain age. And the nice thing is we do have other options where there are appliances that sit in the patient's mouth. You don't even know it's there unless, you pull your cheek out and show them. And it's just as effective or even more effective in some situations than what a headgear used to be. And then, with the pain levels, for example, like Invisalign, because you're changing your aligners every, so many weeks or so, that pain level tends to be a little bit smaller and it's a little bit more gradual. You still will get a little bit of discomfort because the teeth are moving.
Right.
That being said, it's not like a big adjustment and then you go for 4 or 8 weeks and then another big adjustment. It's those big adjustments that can cause quite a bit of soreness.
I remember having spacers put in a week before I got the braces.
Yep.
That was not pleasant.
No, the spacers are something that, we do less and less. So even in our patients where we do either metal braces or clear braces, oftentimes we don't need spacers because we're now able to bond the brackets directly to the teeth. And that's just because, again, the technology is better, the bond strengths are better. So this way the braces are staying on those back molars where back 10, 15 years ago, that was not the case.
I like how you say 10 or 15 years ago, because we're actually, I was going to say probably 25 or 30, but you know what? I'm going to stick with your 10. Let's use your numbers.
I like it.
Let's use your numbers. School's coming right around the corner.
Yep.
We have starting probably very soon. It's July, and I know school starts in August, so probably in a couple of weeks. Football practice is starting. All of the teams are starting up. And one thing which is, as a mom, I was always concerned with is protection of the face and the teeth and broken bones.
Yes.
So let's talk about, since teeth are your specialty, do you have anything you could recommend or that your office does as far as protection for the teeth, these kids, playing football and stuff?
Yeah, absolutely. So, one thing that is really important is to have a mouth guard that fits properly, okay? Not only is that important for protecting the teeth, but also compliance. I mean, how many times do you see kids out on the field where they're chewing on half of their mouth guard?
Right. Oh, no, all the time.
Yeah. Those mouth guards are more effective chew toys in essence than they're actually providing protection.
You're not wrong.
So, so what we do is we actually have a custom mouth guard program that we do at our office. And what's nice about it is these mouth guards fit very securely. If it's football, you can still attach the football attachments to them, the chin straps and all of that.
Right, to the helmet, sure.
Other sports where they don't need the straps, we don't have to attach those. The patients, they can either do, their name in it or their number and their team logo, so they get to have fun with it. So they tend to have more pride over these. It's not something that they're just sitting there chewing on. The other thing is because they fit so tightly, they actually have to go up, put their finger in their mouth to pop the mouth guard out so that they can go ahead and chew on it. So they're trying to actively chew on their mouth guards. So what we find is our moms who come to us for these mouth guards, they tell us that the mouth guards are lasting their kids longer.
Sure.
And it's genuinely because the kids aren't really able to chew on them because they have to actually pull them out to chew on them. These stay in there. They stay in nice and tight so that the kids aren't fussing with it during practice, during games, things like that.
And it's going to do what it's actually meant to do.
Yeah. And, honestly, when they fit properly, studies do show that mouth guards that fit properly are more effective against certain types of concussions, especially when you fall and you bite your teeth together. That can actually cause a concussion because of how your joint slams up into the skull base.
That is really super important.
Yes.
Because that is a major thing there. I mean, every year we're talking more and more about concussions and whatnot. Dr. Megan LeCornu, please tell me, you're on Lyons Avenue, yes?
Yeah, so we are right down the street from you guys. We're off of Lyons Avenue.
You're part of Gilbertson and LeCornu.
Yep. So I joined Dr. Gilbertson's practice about 3 years ago. And so, we're right here in town. If you ever have any questions about mouth guards or anything like that, you can call our office at 661-259-2388. And you can also just, look on our website for any information regarding that stuff. That one's at www.embraceyoursmile.com.
Embraceyoursmile.com. Go see all the pictures, see where they're located. Any questions, 259-2388. Always a pleasure, Dr. Megan LeCornu.
You too.
We'll see you very soon. Thanks for coming in.
Thank you.